Are you considering telehealth for a private practice, but you're unsure if it's the right move for you? In today's fast evolving healthcare landscape, telehealth has become a buzzword. But does it truly benefit you and your patients? In this video, we're going to break down what telehealth is, explore its pros and cons, and help you decide whether it's right for your practice. Now make sure you stick around to the end because we're going to show you how you can incorporate telehealth into your practice. Hey, I'm Jamie Spand. I'm a healthcare consultant with over 20 years of experience working with private practice physicians and med spa owners. Make sure you like and subscribe to this channel so that you can get notified whenever we post the next video. Now let's dive right in. So what is telehealth? Telehealth is basically using communication technology and providing healthcare from a distance. It can be used by using their smartphones or other smart devices to collect data and send it. It can also be used by meeting with a provider through a computer one-on-one. Now, there are many different platforms you can use for telemedicine. So start by checking with your EMR system and see if they offer something for you. There are also many other companies that provide ancillary opportunities using telehealth. Now let's talk about, is telehealth right for your clinic? Things to consider before bringing telehealth into your practice would be demographics. If you have an older population that might have a hard time getting in to see you, then that would be a really good fit. It's also really good for patients who live in rural areas or who maybe are too far from the provider and they can't drive there. Also think about people who don't have a car or maybe who can't afford to get to your practice to see you. It's also a really good way to add a provider as part-time or full-time because this is something they can do from their home, which is really good if you're looking to expand your practice, but you don't really have the space to add another provider. So now let's talk about pros of telehealth. First, it's super convenient for both patients and providers. It can reduce travel and wait times. You can also increase your patient reach. You have access to patients in rural areas who wouldn't normally come in to see you. You can also reach underserved populations. Another pro is increased revenue and efficiency. You have the ability to see more patients in less time. You're also going to get improved patient satisfaction because they get faster access to care and follow-ups. Another pro to consider is privacy. There's a lot of patients who don't want anyone to see them at the doctor's office for different reasons, like for privacy purposes. So now let's talk about cons to telehealth. The first one's going to be technology challenges. You've got equipment costs, connectivity issues, missed calls, and platform learning curves for both the provider and for the patient. Next up is going to be regulatory and licensing. You need to make sure you're compliant with state laws and insurance requirements. It could also have an impact on the quality of your patient care. You could have difficulty diagnosing certain conditions remotely. Providers aren't able to do a physical exam or use all of their senses. Last but not least, patients' access to technology. It would exclude patients who really can't figure out how to use technology or who don't have a computer or technology to be able to jump on a call and see you. So now let's talk about how to implement telehealth into your practice. First, you need to assess their needs. Identify patient demographics who could benefit the most from your using telehealth with you. Evaluate services that would be most beneficial to using telehealth. Maybe consultations, follow-ups, mental health, things like this. Next, you need to choose the right platform. Make sure you research HIPAA-compliant platforms. Then make sure it integrates well with your electronic medical records. Next thing you need to do is make sure you're training your staff and your providers. You need to make sure you train them on how to use the platform effectively. Make sure you develop clear protocols for how to do consultations. Include making sure they provide the right information to the patient on how to log into the platform and send a reminder message to make sure they show up for their appointment. You should also make sure you note how long you'll wait for the patient before you hang up because they're not there when they're supposed to be there. The next thing you need to do is update your policy and procedures. Ensure compliance with licensing, insurance, and legal regulation. All states are very different. And also make sure you have a telehealth consent form for your patients to sign prior to their appointment. Next, communicate with your patients. Make sure you're educating your patients about the benefits on how to access telehealth services and what services you offer. And make sure you provide some kind of handout or you can email them this information. Also, make sure you're providing technical support for common questions and answers on troubleshooting issues. Start small. Launch with limited services and a small patient base till you get things figured out. Gather feedback, refine workflows, and improve your patient experience. Then you can start to grow. Telehealth has the potential to revolutionize how you run your private practice, offers more convenience for patients, and it boosts your practice's efficiency. But implementing it efficiently takes planning, resources, and the right mindset. Telehealth can also be a game changer for reducing no-shows and cancellations if it's set up correctly, which is one of the biggest challenges many clinics face. So speaking of no-shows and cancellations, if you're interested in learning strategies on how to decrease no-shows and cancellations and keep your scheduling running smoothly, check out this video. If you're interested in setting up a one-on-one call with me, click the link in the description and set up a free call. See you in the next video.